Hospice care. Here are a couple of things that happen when a resident goes on hospice. Hospice will order new medications: morphine, lorazepam or Haldol, hyoscyamine, ondansetron or Zofran, Tylenol suppository, laxative suppository, oxygen, and a medication crush order, all to be as needed. Hospice will order new equipment such as oxygen concentrator and portable tanks, air mattress, side rail pads, and a suction machine as needed. Hospice visits will include a registered nurse weekly and will increase as the resident declines, home health aide twice a week for shower and bed bath, and chaplain and social worker as needed. Main changes to care plan when on hospice include: you do not have to take vitals 3 times a day. Once a day is good. Do not send out to the hospital without the approval from hospice. No x-rays or labs are done without the approval from hospice. And no physical therapy will be ordered. When a resident has a change of condition, it will sometimes include changes in eating and drinking, such as pocketing food, which is keeping food and their medication in their cheeks. They cannot swallow, so they will begin to spit out food or medication. Refusing to eat, choking on liquids, needing assistance with feeding, and diet. Hospice can order a diet change, such as a soft diet, puree diet, and or thickened liquids. Changes are also in mobility. Make sure we're monitoring closely for falls. Use a walker or wheelchair when necessary. Provide more assistance as needed, such as brief changes or showers and bed baths. Also, different changes that can occur are with pain and or anxiety. Remember to offer PRN medication, reposition the resident consistently, offer comfort and reassurance to the resident. The resident can also become confused, so make sure we're assuring the resident that they are okay and help provide redirection. If behaviors also occur, make sure you notify your field staff so it can be reported to hospice. When a resident starts the dying process, signs of dying can include unable to eat or swallow medications, unable to get out of bed or move without help, unable to follow directions or answer questions, low oxygen and low blood pressure levels, and breathing changes such as short breaths, long pauses between breaths, and a gurgle in their throat. When the resident is going through this process, hospice will discontinue all their regular medications and only leave these: liquid morphine, lorazepam or Haldol, liquid form, hyoscyamine, ondansetron or Zofran, Tylenol suppository, and laxative suppository. Here is how we will start the comfort medications routine. Liquid morphine every 4 hours. Look for signs of pain and request a PRN dose be given in Slack. Hearing moaning, crying, seeing grimacing on the face, stiffness, or a clenching fist can also be signs of being in pain. Liquid lorazepam or Haldol every 4 hours. Look for signs of restlessness, anxiety, and calling out. The morphine and lorazepam/Haldol can both be increased to every 2 hours. Comfort techniques. Morphine and lorazepam/Haldol. Don't be afraid to give these medications. They will help the resident be comfortable and breathe easier. Remember to use a moist toothette, which looks like a sponge on a stick. It provides relief from dryness in the mouth, and it cleans out any buildup on the teeth and gums. Use this every 2 hours or more as needed. Make sure we are putting the resident in the recovery position. Apply Vaseline to the lips to relieve dryness. Talk and comfort the resident. They can hear up until the end of life. Here is a visual guide on how to put a resident in the recovery position. Lay the resident on their side and place a pillow behind their back. Float the leg with enough pillows to be supported, and also float the arm with a pillow. When a resident passes away, please contact your field supervisor or administrator. The administrator will call hospice. Hospice will come out to confirm time of death. They will also prepare the body for pickup. Hospice will call the family to notify them and to offer to come see the resident. Hospice will also call the funeral home. The funeral home will come within 2 to 4 hours to come and remove the body. Family support. Remember to be kind to families during these difficult times. You can do this by welcoming families every time they visit. Check in on them regularly during their visit to see if they need anything such as refreshments or assistance. Remember to always knock before entering the room to do care or check-ins. We want to thank you for your care, your kindness, and for your commitment to our families during their difficult time. Remember that we are also here for you. Feel free to contact the administrative office if you ever have any difficulties.